Good morning, it's Dr. John Keeling. I'm a local orthopedic surgeon here in Chevy Chase, Maryland at Montgomery Orthopedics, division of the Center for Advanced Orthopedics. I recently contributed to a commentary article in MS Now from Mike Wise, my prior neighbor, and a Washington Post sports writer about the decision-making process of Lindsey Vonn to compete with an ACL deficient knee. In my capacity as a surgeon, generally I try and tell my patients or advise my patients to be more conservative and not take risks, but in this case, we all know the choice that Lindsey made. I applaud her for her decision-making process and the choice she made. As a physician, again, I tend to be more conservative. As an athlete and a competitor myself, I understand the challenges, and I've certainly taken my share of risks throughout my lifetime. That being as it may, now we're in a situation where Lindsey unfortunately has sustained, in her description and on the internet, a complex tibia fracture. I have, fortunately or unfortunately, a lot of prior experience treating tibia fractures, particularly open tibia fractures associated with blast injuries from the wars in Iraq and Afghanistan during my time as a orthopedic trauma surgeon in the Navy at Bethesda Naval Hospital. So they are complex injuries. There's a hint from what we can see based on the photographs from Lindsey's hospital room that she's sustained an injury that's severe enough that it's required multiple, at this point, 4 surgeries and placement of a spanning external fixator. You can see that on her leg. So my idea today, after being asked by several patients, family members, and neighbors what's going on, is to try and unpack and take a peek under the Lindsey's hospital blanket and try and make sense of what's going on with their leg. So tibia fractures are complex based on where her external fixator is placed. From her thigh bone down to the midshaft of her tibia, it seems like she has some type of an injury around the knee. If it's truly only the tibia, then it's probably the proximal aspect of the tibia, including what we call the tibial plateau, which is the flat part just underneath the knee itself. These can be challenging injuries to work on, to fix, to rehab from, because it does involve one of the largest long bones in the body, the weight-bearing tibia, and the knee joint itself, which is a main weight-bearing bone, used a lot for athletics and certainly skiing. These injuries are classified according to what's called a Schatzberg classification. There's a 1 through 6, and they can be as simple as a little fracture through the lateral condyle of the tibia, to more extensively in multiple areas with multiple fractures that involve the joint and the area of the tibia bone below the joint. She also may, or probably, I'm guessing, has some component of an open fracture, or had a injury that she sustained that was severe enough that the energy of the injury caused so much damage to the bone that it affected the surrounding soft tissues, the muscles, the nerves in the back, the arteries, the veins, and that caused so much swelling in the leg that it necessitated something called compartment fasciotomy. So when there's so much injury in the leg as a result of these type of high energy crashes, motorcycle accidents, skiing injuries where you're unrestrained, the energy of the injury just blasts the soft tissue. They get swollen, blood supply can't get into the injured tissue, and the surgeon's forced to release those compartments through large incisions that go on either side of the leg to let the muscle breathe and allow blood flow into the leg. Otherwise, some of the tissue in the leg continues to die, and you're probably heading for an amputation. So assuming that she has one of the lower grade open fractures, there's a 1, 2, 3, 3A, 3B, and 3C. Assuming she has a lower grade open injury, a 1 or a 2, generally treatment protocol is for civilian injuries that don't involve open wartime penetrating trauma. Pretty straightforward with respect to what we've, as a community of orthopedic surgeons, come to accept. The patient's fracture is stabilized, and you can see she's got an external fixator on. IV antibiotics are started almost immediately to mitigate the risks of infection. The patient's taken to the operating room to examine the soft tissues and remove or debride any injured tissue. And then some type of dressing is typically placed on it. These days, predominantly we use, and what we used extensively in the military, were wound vacs. These are devices that can be placed on the leg in the wound with a sheet of sort of like saran wrap with a suction device that helps to drain and keep the wound mostly non-contaminated. My guess is that these fasciotomies had to be debrided, or her open wound and soft tissues had to be debrided a couple times. That's probably the reason why she's gone back for multiple surgeries. This is common in this setting. Once the soft tissue is stabilized and the wounds are ready to be closed, which may have happened when she was in the operating room at this last meeting on Saturday, plan can be made to stabilize the fracture. Traditionally, for civilian type injuries, even open ones, once the soft tissue component is stabilized, metal can be placed inside the body. The risk of infection is pretty high if you put the metal in too early, but if you stabilize the soft tissue component and then place the fixation, you can do it relatively safely. For long bone tibia fractures, that usually involves an intramedullary nail device. For fractures around the tibial plateau, that typically involves some type of plate and screw configuration. My sense is that that's probably what Lindsey has, or maybe a combination of the two, so she'll probably end up with some type of plate and screw fixation definitively. I think that's going to happen back in the United States based on all indications from the media and what she's placed on Instagram. When I was in the Navy and I dealt with injuries that were much more extensive, including blast type trauma, many times to stabilize the injury we use devices like this. This is called an external fixer device. This allows the patient's fractures to be stabilized outside the body with metal pins that get drilled into the bone on either side of the fracture, sometimes little wires that go across and stabilize the articular component or the joint component of the fracture. And then that allows the patient to rehab, lets the bone heal, and then ultimately, once the fractures are healed, the ring external fixator can be taken off. Interestingly, in Lindsey Vonn's case, that's a consideration. I'm not sure the extent of her wounds or soft tissue damage, but keep in the back of your mind, she still has an ACL problem on that side, so the ACL is deficient in that knee. Once the fracture's healed, she'll most likely consider an ACL reconstruction. It's difficult to do an ACL reconstruction with hardware that's still in place because you have to drill tunnels in the bones to fasten the ACL in place. So one consideration would be if there's extensive soft tissue damage and she wants to be in a situation where there's no longer hardware, a ring fixer could be used in this application. Otherwise, if a metal plate and screw configuration is used to stabilize the fracture, that'll probably have to be taken out before the ACL reconstruction. Well, I hope that helps folks understand the nature and extent of these types of injuries and what has to be done to go through the process of stabilizing the bone, stabilizing the soft tissue, getting the soft tissue clean and closed without any evidence of infection, and then coming back ultimately to provide stability to the bone so it heals in a safe way. All my best to Lindsey in her recovery. Hope things go well with her and her surgical team. My family and I are frequent visitors to Vail Ski Resort yearly, and hope to see her out skiing on Lindsey's run at least sometime next year. Thank you for your time.